Hello, my name is Stephanie Bittner, and I chose to research about rheumatoid arthritis. What exactly is rheumatoid arthritis? Rheumatoid arthritis, also known as RA, is a chronic autoimmune disease which inflames the joints, typically the small joints in the beginning early stages of the disease. RA causes the immune system to attack all of the healthy cells. For example, the synovium that lines the joints. You can see pictured here the normal joint, and then you can see a joint affected with rheumatoid arthritis. You can see the swollen synovium membrane that surrounds the joint is inflamed and very red. You can also see the bone erosion. This causes a lot of pain and inflammation. What body structures are affected by the RA? Immune system, skin, eyes, lungs, blood vessels, and joints. Who specifically is affected by RA? RA can affect anyone at any age, but is more commonly affected people after the age of 40, and mostly common in women. Of all the people who have RA, 70% of them are women. They think that because the females carry the female hormone that is more common in women. Signs and symptoms of RA. Symptoms can be different for each and every person. RA affects a person symmetrically. For example, if it affects the wrist, it's going to affect the other wrist too. You can see pictured here all the different joints and that they affect both of them, not just one. Early stages of RA affects smaller joints, like I said before, but as time passes, it will spread to the other joints. Signs and symptoms of RA: loss of appetite, weight loss, fever, morning stiffness, warm, tender, swollen joints, anemia. RA can be really hard to diagnose. There is not one single blood test to just diagnose you with RA. You have to go through a physical exam to see the muscle strength, and it just may take a long time to diagnose RA. Like I said before, symptoms can come and go, and it can affect each person differently. There can be flares, which is episodes of pain and inflammation. This can occur after an infection or high levels of stress, but it's not always clear what affects or what triggers these flares. You may also have remission, which is when there's not a flare, and you can have long periods of time where you're just in remission, where your disease is just quiet and there's no inflammation, no pain. But then suddenly, just like that, a flare can happen. And that's why this disease is just so debilitating. You never know what your day is going to be like if you wake up and you have a flare. And it can last for a while. You just have good days or bad days. You can't tell. And it's just, What causes RA is truly unknown. There is a lot of information about RA and how it affects the body and how the inflammation affects the immune system, but the true cause of it is unknown. Treatment for RA: medication, which can help the pain and inflammation and also slow some of the joint damage. But it may take time to figure out what medication works for each and every person. You may have to try one medication and that might not work, and then try a different medication, and that may work for 2 years, and then it just doesn't work anymore. You have to try a different medication. And there can also be lots of bad side effects or good side effects of medications, and it may not work for just one person. So each and every person is really different when it comes to diagnosing and figuring out which medication works for them. Also, physical therapy, exercise, and sometimes surgery may help too. Some long-term consequences of RA, as you can see pictured here, deformities of the hands and the feet, which can make it really hard to even have any function of your hands. If you can see in the late RA stages in this last picture here, that person most likely can't use their hand. If it's so tight and swelled up like that, there's just no function. And also there can be, like I said just a minute ago, the side effects of the medication can cause cataracts. You can see in this picture down here that the lens is clouded by this cataract. And that's it. Thanks for watching.